MG, a lowercase m and a lowercase g, stands for milligrams. Lowercase m, lowercase l stands for milliliters. NV, nausea or vomiting, often seen together when the patient complains of nausea and may have vomiting. OD, right eye. OS stands for left eye. OU stands for both eyes. Sometimes we will see the notation of just a uppercase P. It stands for pulse. It is one of the vital signs that is recorded as part of the physical examination. PC stands for after meals, as a patient will take certain medications after they have had a meal. PO means by mouth. And another common abbreviation, PRN, means as needed. The patient will take a certain medication as it is needed. It may not be on a regular basis, or a procedure such as a dressing change will be done PRN, as needed. QD, lowercase q, lowercase d, sometimes you may see it as uppercase, means each day, as in a patient will take a medication each day. QID means 4 times a day, as in taking a certain medication 4 different times during a day. Q2, the number 2, and H refers to how often a medication or procedure would be done. Q2H is every 2 hours. Another example, Q3H would be every 3 hours. QAM would be each morning. QHS means at bedtime. QOD means every other day. The patient would take the medication every other day. QPM means each evening. Going back to our quadrants using the abdomen, RLQ, right lower quadrant, RUQ, right upper quadrant. SOB, shortness of breath. SQ, subcutaneous. A medicine is given in the subcutaneous layer of the skin, such as insulin for diabetes. T, uppercase T, temperature. It is one of the vital signs. TID means 3 times a day. A lowercase tsp, teaspoon. And UTI is a common abbreviation, stands for urinary tract infection. URI, upper respiratory infection.